Hello and welcome, everyone. I am Joanna Cohn, Director of the Institute for Global Tobacco Control at the Johns Hopkins Bloomberg School of Public Health. I am thrilled to join you as we announce updates to the Global Tobacco Control Progress Hub. Launched in November 2022, the Progress Hub is a global surveillance, monitoring, and reporting platform that actively tracks the implementation of the World Health Organization's Framework Convention on Tobacco Control. This data analytics and visualization platform has allowed users to access 300 indicators from the WHO's tobacco control datasets, representing 12 years of reporting from more than 180 countries. The hub makes a significant contribution to global FCTC surveillance by providing essential data infrastructure and enabling all tobacco control stakeholders to participate in monitoring, surveillance, and reporting. Today, we unveil significant updates which will provide even more tools for this effort. Users now have access to a new Meeting of the Parties dashboard. This provides country reporting data on illicit trade not previously available on the Global Tobacco Control Progress Hub. We have also added WHO datasets from 2022-23 for the most up-to-date information. Hub users now have access to more than 500,000 data points along with new functionality, which allows users to download spreadsheets for all data views to allow for deeper analysis. And more dashboards are in development. Tobacco control advocates have used the hub for important research since its launch. The information in the hub has helped advance tobacco control efforts in multiple countries, including with shadow reports. We know of more than 30 shadow reports created using information from the hub, and we hope that number continues to grow with these new tools. I am grateful to Les Hagan, Executive Director of ASH Canada, for his continued work on expanding the possibilities of the hub. The project is funded by Bloomberg Philanthropies through an existing grant with the Institute for Global Tobacco Control. I would like to extend our sincere gratitude to the World Health Organization's TFI and the Framework Convention Secretariat for freely sharing their data sets and for providing their guidance, support, and expertise along the way. And also thanks to the 15 tobacco control experts from around the globe who guided the initial development of the Progress Hub. The growth of the Global Tobacco Control Progress Hub provides an expanded new window on the world of tobacco control monitoring and surveillance. We invite everyone to engage with this platform to help inform, guide, and enhance tobacco control efforts in your country and around the world. It is now my pleasure to introduce Les Hagan to provide you with an overview of the updates and expanded capabilities of the hub. Over to you, Les.
Well, thank you very much, Joanna. And I certainly express my deepest gratitude to Joanna and her team at IGTC for all the support and guidance we have received in the development of the Global Progress Hub. And of course, Bloomberg Philanthropies for sharing our vision and generously supporting this joint endeavor. I'm delighted to be with you here today to discuss recent updates and enhancements to the Progress Hub and some of the outcomes along the way. And I'll start by providing an overview of the hub for those who may not be familiar with the platform. The Global Progress Hub is an open access data surveillance platform that provides a window on the world of FCTC implementation and represents critical monitoring infrastructure for the treaty. As many of you know, the WHO Framework Convention on Tobacco Control is the world's first and only public health treaty. This means that the Global Progress Hub is the world's first and only open access surveillance platform for a public health treaty. The hub contains, as Joanna mentioned, the hub contains 400 indicators for over 180 countries spanning 12 years of reporting, and it represents over 500,000 data points, which can be accessed through various user interactions. So over 180 countries have been reporting their progress on treaty implementation since 2008. However, until recently, these important data sets were not consolidated, assembled, and organized in an online, functional, user-friendly manner that all tobacco control stakeholders can readily access. The absence of a consolidated online surveillance platform has constrained treaty monitoring, reporting, and implementation. In creating this platform, we strive to provide as much detail and facilitate as many user interactions as possible within the limits of the data sets, the chosen platform, and our budget. We've tried to ensure that the data can be applied to practical tobacco control efforts, including active monitoring, surveillance, and reporting, in keeping with the objectives of the treaty. We're also trying to engage as many stakeholders as possible, including those who have not participated in surveillance and reporting activities in the past. As most of you are aware, the Framework Convention was formally implemented in 2005, and over 180 countries are participating in the treaty. This is one of the highest implementation rates of any treaty. The treaty articles are evidence-based and reflect proven strategies to reduce tobacco use. The treaty provisions have been credited with saving millions of people from an early and agonizing death from tobacco use. Parties to the treaty are required to submit biannual implementation reports to monitor progress in adopting the treaty provisions. And the FCTC Secretariat collects these reports and compiles and catalogs the resulting data sets. These data sets have been consolidated on the Progress Hub, and it provides an engaging and interactive user interface for all of this data, or the vast majority of this data. Articles 20 and 21 of the FCTC address monitoring, surveillance, and reporting, which are considered to be cornerstones of the treaty. Progress cannot be evaluated without being measured. As mentioned, the Progress Hub allows all tobacco control stakeholders to participate in these critical activities. Here are some of the previous challenges prior to that helped to justify the creation of the Progress Hub. Prior to the hub, there were limited opportunities to compare FCTC, Empower, and MOP performance between countries. Limited access to the actual data sets, there were, for those who had access, it took some work to actually use the data. So we've tried to simplify that. There were low shadow reporting rates by NGOs. And there wasn't instant online access to scores and rankings for all of the FCTC articles and the Empower measures and the MOP indicators. So we've tried to solve a number of those problems. And the creation of the hub has liberated 3 major tobacco control monitoring data sets, including the FCTC, the MOP, which we're talking about today, and Empower. The hub provides ranking and scoring for each FCTC and MOP article and Empower measure by reporting country. It allows for data breakdowns, comparisons, and groupings. You can reveal multi-year implementation trends by country. It has allowed us to engage more tobacco control stakeholders in surveillance, monitoring, and reporting, and we'll be getting into that. And it supports improved treaty implementation, including civil society shadow reports, article profiles, and various outputs and capabilities of the hub. So here are the existing features and functions of the Progress Hub. We are displaying we're displaying 248 of the FCTC indicators with ranking and scoring. We're displaying all of the Empower indicators with ranking and scoring. We provide global and regional comparisons, as well as comparisons by income grouping and Human Development Index. We are allowing for exportable data visualizations in various formats. And we're providing comparisons by allow for comparisons by FCTC articles and indicators, Empower measures and indicators, now MOP as well. And as I mentioned, comparisons by in country income levels and human development index gradients. And here are our major outcomes since 2022. We've helped to facilitate 33 shadow reports from NGOs in 33 countries. And if we add up the populations of all of those countries, it's 2.6 billion, or about 1/3 of the global population. So we've been able to reach an enormous number of people through the help and collaboration of 33 NGOs, at least from a tobacco control reporting perspective and surveillance perspective. We had produced a global news release on the Empower slowdown that went out last fall, and we had extensive coverage, global coverage on that particular finding. We have produced profiles for 15 key FCTC articles. We've done several conference presentations, and we'll be doing more this fall. We have 2 journal publications forthcoming, one on the development of the hub and another on the Empower longitudinal data. And we also have an SDG shadow report forthcoming. And here are our new features and functions, and I know that's why you're joining us today. We've got a new MOP dashboard with data sets for 2018, 2022, and 2023. And MOP came into effect in 2018, so it's the complete data set. And we've updated the 2022-2023 data sets for Empower and FCTC, so everything's up to date. We've got a new Explore Data function to give everyone who visits the hub instant access to the source data. We have created enhanced shadow reporting procedures to simplify that process for NGOs. And forthcoming soon, we will be launching another dashboard for the FCTC Global Strategy, also known as the Accelerator, FCTC Accelerator, and a COP decision tracker that'll allow people to look at all the decisions, all the major decisions since COP1, and determine and to be able to establish what kind of progress has been made on the decisions. And we'll also be producing profiles for all the Empower measures this fall. So I'm going to talk now about civil society shadow reporting. And this is a major feature function of the Progress Hub that we're very proud of. And the Framework Convention for Tobacco Control has assigned civil society engagement as it's a cornerstone of the treaty. And this special status has been enshrined in the treaty since it was first approved in 2003. This status is significant, and most UN treaties do not provide special recognition for civil society organizations. In fact, I participated in the treaty negotiations for the forthcoming UNEP Plastics Treaty in Ottawa earlier this year. And special status has not been granted in that treaty for NGOs. It may be in the future, but it's not there now. And as you all know, NGOs have played an enormous role in developing and implementing the FCTC, and we are pleased to support these efforts with the Progress Hub. To our knowledge, our one-year shadow reporting efforts have surpassed previous annual results and have enhanced NGO monitoring and reporting of the treaty. We are delighted with our year 1 results, and we plan to build on this success. Here are the countries that were represented by NGOs who participated in our shadow reporting effort. The majority are low and middle income countries from the global south. And we offered a bursary to NGOs to allow low and middle income countries, for NGOs in low and middle income countries to help boost participation. As you know, many of these countries are struggling with the implementation of the treaty, and they need all the help they can get. African and American countries are well represented on this list. The lowest participation levels were from the Eastern Mediterranean region, and we plan to address this going forward. And here's a listing of the 33 plus organizations that use their shadow reporting function. Some of these organizations are national coalitions with numerous members. We recently conducted a user survey, very recently conducted a user survey of these NGOs, and the majority revealed that they would have struggled to prepare a shadow report without our assistance and intend to use the shadow report for their national advocacy efforts. A strong majority plan to use the Progress Hub for future shadow reporting and recommend that other NGOs do the same. We will be compiling case studies on NGO utilization this fall. We extend our sincere gratitude to all of these organizations for collaborating on this global surveillance and reporting campaign. And next slide. Here are some excerpts from one of the shadow reports, just to give you an idea of what's involved. And for the shadow report we provide a template for NGOs to allow them to select their chosen views from the Progress Hub based on their national priorities. The NGOs add observations and recommendations below each view and prepare an executive summary and overall conclusions and recommendations. These templates and data views simplify the process while providing a detailed analysis of implementation for each chosen Empower article or Empower measure. NGOs from 3 countries reported solely on national Empower implementation since our governments have not ratified the treaty and are therefore not reporting on FCTC implementation. And here's a breakdown of the frequency of FCTC articles that NGOs have reported on. Articles 11 and 13 are the most popular, and they address packaging and labeling and tobacco advertising and promotional and restrictions on tobacco advertising, promotion, and sponsorship. Articles 5, 6, and 7 are also quite popular and address industry interference, taxation, and protection from secondhand smoke. Going forward, we hope to see improved implementation of Articles 18 and 19, especially with the related decisions approved at COP10, and with Articles 8 and 10 regarding regulating the contents, emissions, and disclosures of tobacco products. Here are the Empower measures that NGOs reported on. Package warnings were the most popular, followed closely by monitoring tobacco use, protection from secondhand smoke, and raising taxes. Mass media campaigns and smoking cessation efforts were the least popular measures to be reported, which may reflect limited government funding in low and middle income countries. NGOs are also expected to share their shadow reports with the FCT Secretariat, as outlined in this document. We are sharing all of the reports created on the Progress Hub with the Secretariat, and we hope they can be put to good use. Moving on from the shadow reporting, the Progress Hub has also produced global profiles for 15 key articles of the Framework Convention. These profiles provide a detailed breakdown of global implementation results by key policies and activities. The profiles can be used for comparison and reporting purposes and provide new insights into treaty implementation that were not previously available. We will be producing profiles for Empower, as mentioned earlier, and this fall. One of the core functions of the Progress Hub is to report on new trends and developments that we identify in the data sets. Last fall, the Progress Hub publicized the new Empower reporting data, revealing a significant slowdown in global implementation between 2020 and 2022 during the COVID-19 pandemic. As you can see in the chart, this was the first significant scoring slowdown since Empower was launched in 2007. 2/3 of reporting countries reported no improvement or a decline in Empower scoring during this period. The largest declines were recorded in the Eastern Mediterranean and Southeast Asian regions. However, a slowdown was observed in all regions. Based on recently published projections of the impact of Empower, this slowdown has the potential to result in millions of additional smokers and premature deaths, especially if the trend is sustained. Many researchers and health organizations reported on the impact of the pandemic on smoking behavior. However, very few have reported on the pandemic's potential impact on tobacco control. The pandemic affected many sectors, and public health was not spared from this global crisis. We witnessed a significant impact on tobacco control activities in Canada during the pandemic, and these observations have been published. We're planning to publish the longitudinal Empower scoring results in the near future to reflect on tobacco control progress during this critical period. This chart is from the Global Tobacco Use Trends Report released by WHO earlier this year, and it confirms that global progress has slowed since 2020. As stated at the bottom in the blue highlights, at the current rate of decline, it'll take an extra 4 years to achieve the global 30% reduction initially projected for 2025, using 2010 as a baseline. This means that the FCT Global Strategy 2025 is not expected to meet its initial overall target, and this target is also tied to the SDG 2030 agenda. This recent chart of SDG indicators published by the UN confirms that tobacco control is currently off target, and you can see the highlighted item in the middle under Goal 3. The UN has reported that the COVID-19 pandemic has significantly affected progress on numerous goals and targets, including Goal 3. The green dots represent SDG indicators that remain on target. As you can see, many of the indicators on this chart are currently off target. I'm sharing these results with you to encourage everyone to redouble their efforts on tobacco control and to focus on high-impact activities that are most likely to produce results. We must ensure that the reported slowdown of tobacco control is not extended or sustained. And speaking of improving results, I'd like to share a new dashboard on the FCTC protocol to eliminate illicit trade in tobacco products, otherwise known as MOP. I know that most of you are familiar with MOP, and here's an excellent summary of the sub-treaty produced by the FCTC Secretariat. About 1/3 of parties have adopted the protocol, so most NGOs need to focus on getting their countries to sign on, including those based in Canada. Fortunately, you don't need to be an expert in contraband tobacco to use our new dashboard or to monitor your country's progress with implementing this sub-treaty. Our goal is to provide all tobacco control stakeholders with easy online access to the reporting data. And here is the new MOP dashboard. This dashboard is modeled after the FCTC and Empower dashboards with similar features, functions, and capabilities. The data set includes all 58 countries that have adopted the protocol, with scoring and ranking by region, national income level, and human development index gradients. And now I'm going to walk you through the new dashboard. And at the top, you can select all the dashboards on the Progress Hub, and you can see MOP in the middle. You can choose your country, articles, and grouping, just as our previous dashboards. And you can see all the articles displayed to the right of the sunburst chart. And those are all the articles, all the key articles for MOP. And of course, we have the groupings by region, by human development index, and by country income level. You can select the year, and we have data sets for 2020 and 2023. Those are the only two data sets available for MOP because it was only adopted in 2018. But even so, we still provide a chart showing the longitudinal, the year-to-year impact. You can download these views in PowerPoint, PDF, or in a graphic image. And we've got this new Explore Data function we're excited about. And that allows you to download all the data you can see on the sunburst chart. And in fact, here is a sample data table that will appear when you select Explore Data. And this feature is now available on all of our dashboards. The data reflects the full contents of the sunburst charts in a what you see is what you get format. To download the data, select the download icon at the bottom right of your screen and choose Cross tab. You can download the data in Excel or CSV formats. You're welcome to use the data tables for further analysis and publication, and we simply request that you provide an attribution to the Progress Hub as it appears on the bottom left of the screen. So before closing, I'd like to review the limitations of the Progress Hub. And we rely on self-reporting by country focal points. That, in fact, that's the nature of the data that is submitted to WHO, whether it's for FCTC or Empower. It relies heavily on self-reporting. Of course, there's non-reporting and under-reporting by numerous countries, and especially with during COVID, there were delays in reporting. And some countries are struggling to implement the treaty and to keep up with reporting. Only binary indicators are selected for the Progress Hub, and that simply has to do with the ability to visualize this data in a coherent and meaningful way. So, all the yes, no, 0, 1, true, false data appears on the Progress Hub. A number of FCTC indicators were omitted due to pruning and bundling, especially for Articles 8 and 14, which each have quite a number of indicators. But we were able to categorize all of these. There are variabilities in country smoking behavior data and in the nature of the data set and the way it's collected. And of course, limitations on the WHO data sets themselves. And a major caveat with the Progress Hub is that it's designed for viewing on laptop and desktop computers only, and it's because of the heavy visualizations. So it's not meant for use on smartphones or tablets. We have a number of important people and organizations to acknowledge, including the Institute for Global Tobacco Control and Joanna and her team. Of course, Bloomberg Philanthropies for providing the funding for this endeavor. The 33 plus collaborating national NGOs that we're excited to be working with. Thank you very much. The Secretariat for the WHO FCTC that's been very forthcoming with the data and participated in the initial development of the hub. And same goes for the WHO Tobacco Free Initiative, who supplied the Empower data and participated on our original advisory committee. Our data vendor, Keyris, who's been very good and has helped us take an awful lot of data and turn it into something that is useful and can be easily interpreted and utilized. And of course, the ASH board staff, consultants, and vendors, including my research director, Fadi Hamal, who's been wonderful at helping to make sense of all this data. This concludes my presentation, and we'll welcome your questions shortly. Please contact me if you need any further information, or if you have any questions for improving the hub, suggestions for improving the hub. We're committed to expanding and enhancing this robust data analytics platform and maximizing its impact on FCTC implementation. We encourage you to visit the updated Progress Hub and to explore its features, functions, and capabilities. And we invite you to take a deep dive into tobacco control and utilize the Progress Hub to support your activities and research. And we can now take your questions.
Great. Thank you, Lester. I have one question already. I'm going to read it as it came in. Shadow reports are most useful in the context of the FCTC COP meetings, when parties brag about their progress, and the FCTC Secretariat publishes its report summarizing data from the parties' reports. Last time, however, the latest data was not available on the hub, probably because there was a delay in publishing country reports. Will this go better at the next COP, or will we always have this problem of data arriving late?
The data always lags behind, but the reports, there are deadlines for submitting the reports, and I believe it's April. It was April. And then once the data is received, it takes time for WHO to compile it and post it online. So that's something we're going to have to continue to deal with. At the same time, we were developing the hub. At least that's not going to slow us down next time. So we will strive to get the data sets up prior to the COPs, but we are relying on A, the countries reporting themselves, and B, the people at WHO having the time to get them all that data assembled and up and on its website. So we will strive to do better next time.
And when
That's a
will
good question.
when will the new is the new hub live now? When can people access?
Yeah, it's live, but yes, absolutely. www.globalprogresshub.com. And you'll see the MOP database alive. We didn't want to encourage people to go on while we were giving the presentation because it's a little distracting, but you're welcome to visit it. And we encourage you to do so.
Anybody else has any questions, you can put them in the chat right now, or in the Q&A. Yes, I see the new, I'm looking at it right now.
And, if people have questions after the webinar, especially NGOs, just send me an email, hagen@ash.ca, and we'll happily respond. We're very eager to work with more NGOs from more countries. And when we are launching a fall campaign to encourage more shadow reporting. So hopefully, so you'll be getting an email from us soon regarding our fall campaign. And our goal is to get our reporting up to 50 countries.
Hey, doesn't appear to be any more questions at this point.
Well, hey, we're happy to give you back some time here, and please use the remaining time to check out the hub and let me know if you have any questions. We welcome suggestions. If there are any, it's a big data. There are a lot of big data sets on the Progress Hub. So if you see any errors or glitches, please let us know. We've done our best, and what I can tell you is with the first run of the Progress Hub, we actually haven't registered any complaints to date, other than one question or one concern around a map. But no complaints or questions about the data. That said, when we're moving around that much data, it's easy for something to get missed or sometimes duplicated. So let us know.